Good afternoon. Today we are at Pelvic Laser Institution. My name is Kevin, and this is my wife Natasha, and we are here with Dr. Thomas Toussaint. And as a couple, we are here because we have some questions regarding pregnancy.
Thank you, Kevin. Thank you, Natasha, for coming today. I'm here to help.
So first off, we wanted to ask, as a couple who are expecting to have a child, when should we start seeing a gynecologist when we become pregnant?
It will be better if you get your first visit even before you get pregnant, because the better idea is you want to optimize your health because before you get pregnant. So a visit to the doctor before you get pregnant will help, so they can assess if you have anemia, if you have any medical problems, and then you end up being pregnant, which is the proper way to start. But it usually happens the other way around. When people get pregnant, this is when they come to the doctor. And at this time, there are things we might be missing. But the best idea is check out with the doctor if you're planning to be pregnant. And okay, I'm just going for a regular checkup. I'm planning to be pregnant sometime this year or next year. I want to get a checkup. And that also can be done at your well woman exam. It doesn't need to be a specific visit to be pregnant. At your well woman exam, you can address that with the doctor, and then they will do some blood work testing to make sure you're okay.
Awesome. And then the doctor that we see in the beginning, should that doctor be following us throughout the journey of our pregnancy?
Everything depends. If it is a normal pregnancy with no problem, sure, we can see the same doctor until you give birth. But if there is some other problem that arises during the pregnancy, now the situation will change.
Gotcha. I liked what you mentioned when you first answered our question in regards to being proactive instead of reactive, because in most cases, pregnancies are occurrence of a couple having fun and then finding out. So, um, I guess for me as a man, I probably have a little bit more questions than her immediately, only because during pregnancy, our wives' hormones are all over the place, and even when they're not pregnant, their hormones are all over the place.
Exactly.
So there's
Exactly.
a level of comfort and security that I would like to provide. So very inquisitive, and one of the things that I was considering is how do you know when it's a high risk pregnancy, and what do you do in the cases of high risk pregnancies? Because I want to be as proactive as possible, dog.
Definitely. High risk pregnancy, that varies. We define high risk pregnancy sometimes on the age of the woman. If the woman is more than 35 by age, they consider that being a high risk pregnancy. But whenever you get any medical condition that is part of the pregnancy, it became a high risk. For example, if you have a thyroid problem, it is high risk. If you have anemia, it is high risk. If you have hypertension, it is high risk. If you have diabetes, it is high risk. If you have any other problem for which you are on medication for, whenever you get pregnancy plus something, it's considered high risk. This is the first part of your question. Now, the second part of your question is how do we address that? And to go back again to the question that your wife asked me earlier, should the same doctor continue to see you throughout throughout the whole pregnancy journey? Obviously, whenever you get a high risk pregnancy, you're gonna have to go see a high risk doctor called MFM, maternal fetal medicine doctor. They are the one that will assess your situation and define a plan of action with the primary OBGYN doctor. And through those steps, you'll report to that doctor sometimes every week, sometimes every month, but they together with your primary OBGYN define a plan of action. How often should you go? What are the test that needs to be done? And when it is a good time to deliver that baby.
Awesome. So what can an expecting mother expect during her first visit, and how can she prepare for it?
The first visit, we usually call that the confirmation of pregnancy. Obviously, I don't have my period. It's been 2 weeks, it's been 4 weeks. I take a pregnancy test home, and then it's positive. Boom, I'm pregnant. Yeah, that's a good thing. But do you know where that pregnancy is? That's a better question. That's why we call it a confirmation of pregnancy. Because not because you have a positive pregnancy test means the baby is in the place it's supposed to be. The baby might be out of the uterus, and which is a bigger problem, a big complications that can even cost that woman her life. Because if it's burst and she start bleeding, we call that ectopic pregnancy, which is a medical emergency where you might need to have surgery right away. So for every woman, I would say, whenever you don't have your period and you have a positive pregnancy test at home, the next step is to see an OBGYN as quick as possible. But I would say, if you don't have pain, bleeding, sometimes you can wait. But if you see anything abnormal, like you're having pain in your abdomen and you're having some spotting, kind of bleeding on and off, definitely you have to see the doctor, because they really have to assess if that pregnancy is in the proper location, mean inside the uterus. After you see the doctor for that first visit, now they can delay for the next visit. We usually try to do the next one 4 weeks later, around 10 to 12 weeks, where the pregnancy is almost close to be established, and then we can start doing testing for your blood work and so on.
Perfect. All right. So on top of all that testing that you brought up, I have an interesting question that I was thinking about, and that's in regards to the baby sex. Like, how soon can we determine the baby sex? Because I want to know if I'm gonna start buying footballs and basketballs, or am I buying tutus and ballerina sets?
That's a good question. Science get better at it now. Before, you have to wait until 20 weeks, 25 weeks, where we can only see the sex of the baby with the ultrasound, and then sometimes we might be even guessing. Sometimes we might have to do Madden to a visit if the baby doesn't want to cooperate with you. But at least we get better. We get a genetic testing that we can do between 12 weeks,
Oh,
and at that time, we draw the mom blood, and to the mom blood, we extract some cells from the baby, and then we can see the gender of the baby. So we're gonna see right away, we're gonna know right away if it's gonna be a boy or if it's gonna be a girl. And this is why everybody is happy. Some people want to do gender reveal, all of those things. And if people are interested to do that, there's a way we arrange it in the office. We'll give you an envelope with the sex inside, and then when you go to that party, and then somebody will open it.
Awesome.
That's about it.
great. Great. Well, thank you for taking the time out and answering all of our preliminary questions and everything else. So far over here at Pelvic Laser Institute, the thing that I like the most with you compared to every other place that we've kind of gotten a feel for is how comforting and inviting you've been as a doctor, especially some with men, because men don't really know. Like, it's a weird occurrence for us as well. Like, we're trying to make our women as secure and comforting, but we don't know, because I'm gonna have to pull you to the side and ask some questions so she can know that I know how to properly make sure that she's safe and when her hormones is up and down, to just provide that education that you give us. Thank you a lot for taking the time and being able to provide that for us.
Thank you, Kevin. Thank you, Natasha. I would say also, I think you guys have taken the proper steps to have those preliminary information. And you give a great example to, I would say, that generation of young people who really don't know how to handle properly those kind of situations, especially when you're talking the way you want to be comforting, be part of the situation, be there for your wife. And I think I would tell you, as a man and as an OBGYN as well, pregnancy is easy whenever the couple get involved.
You don't see I'm joining her? I'm not as small as I
But
used to be.
whenever is the woman going to the weight of the pregnancy emotionally, it becomes very painful. So I'll give you props, because you are being supportive to your wife, because she definitely gonna need you. If you are there through the pregnancy, it's gonna be an easy one to the pack. But whenever she feel like she's by herself, she's gonna be miserable. So congratulations, guys. You're in the right path. May God bless you.
Thank you.
Awesome.